Ciao mondo, hello world, hola mundo, hello mon, konnichiwa, ni hao, namaste. We are in Asiago, Italy for the 36th ADQI Conference after the International Vicenza course on critical care nephrology. And we're lucky enough that Katja Gist from University of Colorado and David Selewski for the Medical University of North Carolina.
South Carolina.
Correct?
South.
Yes. Are the organizers of this special topic, which is the interface between extracorporeal lung support and CRRT, fluid management, AKI in these very complex patients. So we will have 5 work groups dealing with different aspects, but what is the mainstay of this conference? Katja, you may tell us.
Yeah, sure. First, thanks for having us. And the purpose of this conference was to bring 2 large organizations together, ALSO and ADQI, and with expertise in the field from both organizations, to really harmonize how we think about acute kidney injury, fluid balance, fluid status, and its complications in people who receive extracorporeal membrane oxygenation across the lifespan.
And David, do you think we can really harmonize adult and pediatric populations in this effort?
I do think yes, that is the goal. I think it is possible. As you know, ECMO was started and really propagated in the neonatal populations, and then there's a lot of experience in neonates and pediatric patients, and then it has now become much more common in adults. And the hope is to bring our experience as pediatricians and in the neonatal group and help our adult colleagues, and together continue to improve outcomes in our sickest patients, whether you're a neonate all the way up to an adult sized patient.
Of course, I'm particularly interested not only for being quite expert on CRRT, but also for the Carpe Diem experience, etc. So Katja, what do you expect from this conference?
Yeah, I think we're going to within each of the working groups define specific statements which will guide clinical practice or provide recommendations for clinical practice, and also set a research agenda so we can also be more consistent and harmonized in how we study these patients for future implementation into clinical care.
So David, the conference is still ongoing, so we're not having the final result yet, and possibly we will have some post-conference activity as well, but we're going to vote today on some resolutions. And what is the way we will communicate? It will be a manuscript?
Yes. The plan is to have one overarching manuscript that will go to a critical care journal, and then to have multiple manuscripts, ideally one from each of the groups, that will most likely go to an ECMO journal such as Asiago, and then also opportunities to do both pediatric and neonatal experiences as well as adults if they are inclined. And then the other work product from this that will not be necessarily in the form of a particular manuscript that I think is going to be long lasting, hopefully, is the collaboration that we're building with our partners in the ECMO world. And so there's already an interest in studies and collaborations in terms of doing studies on acute kidney injury and acute kidney injury, fluid balance, and CRRT related topics as a partnership. So I think that's long.
Taking on that, I think one of my personal hope from this conference, being one of the founders of ADQI, is that we will see a generation of doctors that become expert in ECMO and CRRT and AKI, which is an extremely complex matter, but we need experts in both areas, right?
Yeah, and it's important that you say that, Dr. Ronco, because there's already institutions who have fellowship training for extracorporeal organ support that combine that, and so integrating or bringing those people, collaborating with those people is only going to facilitate our advancing of the field.
So this is a particular satisfaction because many years ago, Rinaldo Bellomo and myself wrote a paper saying give most to our patient, and most was multiple organ support therapy. So absolutely interesting. There is one last thing you may want to do, and it is, do you want to thank the members of industry for supporting this, and also as well?
Yeah, we couldn't have not done this conference without every participant, but most importantly without our sponsors, industry sponsors, also for helping us get here and producing, or hopefully producing, an amazing work product.
And that is it. That's the model. The model is two organizations working together, the Extracorporeal Life Support Organization and ADQI, and moving forward with our partners in industry, and that actually will move the field of medicine forward for all specialties, in my opinion.
And
So
now you will also have the International Renal Research Institute of Vicenza and the Vicenza course of next year, because we want to have reported the results and potentially the initial studies done from this collaboration. So thank you very much, David and Katja, for organizing this. It was a very difficult task, but I think you managed very well, and you put together a bunch of great people, experts, probably the best in the world. With this, thank you very much for joining today, Cappuccino from Asiago, and have a wonderful, wonderful day. Excellent.
Excellent.
Excellent.